Welcome dear viewers to the video on Q point in dissolution testing. In this video we are going to learn about the Q point. What is Q point? What are the requirements for Q point? And how the Q point is set for dissolution testing. Many of the professionals find difficult to understand about this Q point, and many of the people get confused between the Q point, percent release and the specification. So after watching this video you will be able to understand all these things, and you will remember these things for a long time, or you will not forget the basics behind Q point. So let's start with the video. See, Q point is the first you consider Q as a quantity. Once you consider Q as a quantity, then you relate this quantity as a percentage or express this quantity as a percentage. Like in assay, we consider 90 to 110%. That means of the label claim, the formulation should contain at least 90% of the label claim, and in upper range it may go to 110%. Similarly, dissolution testing also involves the quantity, and that quantity is expressed as percent label claim of the formulation. But in dissolution there is no upper limit. Like in assay there is upper limit, but in dissolution there is no upper limit. There is a lower limit, and specification will be like not less than. So consider Q is a percentage of the label claim of the formulation. Now after considering this as a label claim percent or percent of the label claim, now you relate this to the dissolution or drug release. Now Q point becomes the targeted amount of API or drug substance in percentage of label claim, which should get dissolved or released within a specific time during dissolution run. So once you start the dissolution, Q quantity or Q point or Q percentage is the quantity of API that is getting dissolved or that is getting released into the dissolution media with the standard and specific dissolution parameters like RPM, volume of the USP2 apparatus, and the time point will be there. In dissolution there are two things: how much API is getting dissolved or released, and it is getting released at which time point. And that's why there is a rate, dissolution rate. We call it as dissolution rate. And why it is called as a rate? Because we are giving the time limit, and rate is always a measure of the speed. Consider dissolution rate as a measure of speed. So speed in terms of what? Speed of the dissolution or speed of the drug release in the specific time. And now you relate this Q point to the percentage of the API dissolved or released within a specific time during the dissolution run. For example, the tablet is releasing 100% in 5 minutes, or 90% in 15 minutes, or 90% or 100% in 30 minutes, or whatever the time point you give for the standard dissolution run time of 1 hour or 2 hours. That we are going to study in the next upcoming slides. So now Q point, it is the percentage dissolved of the drug substance at specific time point for the IR formulations, and sometimes Q point is also given for the modified release formulations, which are DR formulations or the formulations which are having the longer duration of dissolution run. For example, 2 hours, 3 hours, 4 hours or 8 hours. For some of these formulations, last time point is considered as a Q point and the initial time points are considered as the range of dissolution or the medium time points. So for Q point, you should consider it is the percentage of the API or drug substance released within specific time point. For dissolution and drug release, the specific time is required with certain parameters of dissolution testing. So it depends on the formulation design, API solubility, and like that, it depends on the dissolution testing conditions or dissolution testing parameters like media volume, media composition and pH, apparatus type, and the speed of that dissolution apparatus. For example, RPM of basket and the paddle. So once you set the standard conditions, then you go for the dissolution run. Dissolution rate and the drug release mainly depends on the API solubility and BCS class that is well known to the pharmaceutical professionals. Also depends on the formulation design, which may be IR, ER or delayed release or some other modified release formulations, and the dissolution parameters. If you set the dissolution parameters like 75 RPM for paddle and at another time you set the parameter of dissolution for paddle apparatus as 50 RPM. So dissolution will vary with the speed or RPM of the paddle. That means the Q point will also vary or the release will also vary with the dissolution conditions and the parameters. So always the dissolution parameters or conditions are selected as standard. Now, what is the dissolution run time? So always consider that the IR formulations are tested for around 1 hour. Some formulations are tested for 120 minutes, that is 2 hours. If these are having a profile or slow release, for the formulations which contain low soluble APIs, or if some solid dispersion technology is there, like higher polymer content is there, that time dissolution run may go up to 120 minutes also. So this is the generalized run time for dissolution testing, and for most of the IR formulations it will be 1 hour, and for MR formulations the dissolution run will be several hours like 8 hours to 24 hours. Then always understand that dissolution run time and the percentage release of that formulation or API from the formulation is around 70 to 80% as required for the Q point release. Below 70% Q point cannot be set and should not be set as per the regulatory guidelines, and also above 80% cannot be set as per the regulatory guidelines. So you can set the Q point between 70 to 80% as a standard criteria, and if you are not getting the release of 70 to 80% at initial time point, for example let's say 15 minutes or 30 minutes, then you increase the time, like go to 45 minutes or you can go up to 1 hour, but your dissolution time point should be such that at which the release is 70 to 80%. So if you consider the IR formulations, some IR formulations release very quickly, like 80% above release in the 15 minutes. So these formulations are known as very rapid releasing type of formulations, or the dissolution is known as very rapid release. Then if it is releasing in 30 minutes above 80%, then these are known as rapid release type of formulations. And if the formulation contains the slowly dissolving drug substances or poorly solubilizing or low soluble drug substances, then the release of around 80% or 70% may go up to the later time points or longer time points like 45 minutes or 60 minutes. But generally try to achieve the complete release and always try to have the release of 80% by changing some parameters, like change the media volume sometimes if required for the insoluble molecules, change the surfactant concentration, or change the RPM, and try to get that release so that your specification can be set with Q point of 70 to 80%. And then the discriminatory power is required to be shown and demonstrated with that final dissolution condition and the specification. So now Q is specified as between 70 to 80%, and also Q is the reference value. Q is the reference value to compare the dissolution results. Here focus is required 100% to understand this thing. If you are setting a dissolution specification and if you are giving a Q point of not less than 80%, then 80% is your reference value, and you will compare the dissolution or percent dissolved or percent release at that specific time point with 80%. If it is not 80%, then you will say that the dissolution is not meeting the criteria. If it is above 80%, like 85%, 90%, 95%, 100%, then you will say the dissolution is meeting the criteria. There is no upper limit for the dissolution, only lower limit is given, and as per my consideration and my understanding, the lower limit of 80% is given so that the formulation is not holding the API for a longer time if it is a higher type of formulation, and the API is and the formulation can and is releasing the API above 80% if it is a type of IR formulation, if it is a type of for example ER formulation and last time point is considered like 12 hours or 8 hours. That means the dose is being completely released. That's why 70 to 80% release criteria is given. This was my consideration about this limit, why this limit might have been set, so that the patient will get the total drug release and the formulation will not hold the API. That's why the 80% might be given. Now consider a IR tablet of 250 mg and you are setting 80% within 30 minutes. So 80% of 250 mg will be 200 mg. So this is for your understanding that 250 mg tablet, if it is releasing 80%, that is 200 mg. If you are considering S1, S2, S3 stage, then Q plus 5% is considered. Now many of the professionals get confused at this point, that is Q plus 5. So remember this, Q plus 5 is the criteria for S1 stage where 6 units are tested, and always set a dissolution Q point considering the S2 stage. So you are setting a specification for Q point at S2 stage and not at S1 stage. That is S1 stage is 6 unit and S2 stage is 12 units. Then S3 stage is also 80% and it requires 24 units. So these are the levels for acceptance criteria for IR formulations S1, S2 and S3. Here I am considering the S1 stage so that you can understand the Q point in detail. So for IR formulation S1, S2, S3 stages are there as per USP, and S1 stage means each unit is not less than Q plus 5%. So if you are testing or you want to release the batch on 6 unit dissolution data, then each of the units should not be less than q plus 5. For example, you have set a q point of 80, then each and every individual value should be above 85%. Then S2. S2 is the 12 unit, S1 plus S2, and the q point is the average of 12 units is equal to or greater than q, that is 80%, and no unit is less than q minus 15%. Then S3 stage, average of 24 units. That means you have tested 6 units at S1 stage, another 6 unit at S2 stage, and for going to S3 stage, you are testing 12 units. So now you have data of 24 units, and the average of 24 units is equal to or greater than Q. Not more than 2 units are less than Q minus 15, and no unit is less than Q minus 25. So here also lower side limits are set and not at the higher side. Only in S1 stage, higher side limit of 5% is given. That is, each unit is not less than Q plus 5%. Then how to set the Q point? For generic formulation and also for the innovator formulation, the dissolution testing for QC release or for quality control test, the Q point is set based on to the bioavailability study batches and the bioequivalence study batches. So as per the regulatory guidelines, the Q point specification should be given as the dissolution data of bio batch, that is Q point or percent drug release of bio batch at specific time point minus 10%. So if bio batch has a 95% release in 15 minutes or in 30 minutes, then you can set the criteria as Q is equal to 95 minus 10% becomes 85%. And if you are going to set at S2 stage, then consider the 85% release at S1 stage, that is Q plus 5, and that's why you can set the Q as 80%. Now you can also set the Q point as 70%, 75% and 80% in general, and in the range of 70 to 80%, whichever is coming closer to the bio batch minus 10%. If bio batch is 80% in 30 minutes, then 75% can be set as a Q point. There is always a criteria of not less than the stated Q percent value, and there is no upper value to the dissolution specification. For extended release formulations, the range is given, and at the last time point, not less than some percentage amount of around 80% is given as a Q point. So there are some basic concepts for setting the Q point. Q point should not be set too wide, because if you set the Q point as too wide, then you will not get the discriminatory power, and you cannot demonstrate that the dissolution method is discriminatory. And Q point should be calculated as minus 10% to the bio batch. Should be set considering the S2 stage dissolution of 12 units. So Q point to be set as per S2 stage. The dissolution conditions and parameter to be standard. Don't go for very higher speed for the paddle apparatus like 75 RPM. If you are getting a good release of above 80% in 30 minutes with the 50 RPM, then stability data is required to be considered whenever you are going to set the Q point. So the example is given like the Q point or tolerances for the dissolution Q point will be, for example, not less than 80% Q of the labeled amount. For example, paracetamol is dissolved in 30 minutes. So it is the labeled percentage of the labeled amount which is being released or dissolved in 30 minutes. So this is regarding the Q point. Always have the data of 12 units in your hand from the multiple batches, from the R&D batches, scale up and exhibit batches, and consider the biobatch data, stability data, and then go for the Q point setting and giving the specifications. So Q point is nothing but it is the quantity or percentage of the labeled amount released or dissolved at specific time point or within the specific time point. So I hope you might have understood the Q point, and also watch other videos which are there for setting the dissolution specifications, so you can get the complete understanding about the topic. Thank you for watching the video. Please do like, share and subscribe to Pharma Learning in Depth channel.